Thank you. Good morning, Senator Slapp, Representative Haddad, Senator Kelly, Representative Haynes, Senator Marr, and Representative Rochelle, and members of the Higher Education and Employment Committee. My name is Rachel Khanna. I represent the 149th District of Connecticut. I appear before you today to testify in favor of House Bill 5441, an act concerning college graduates who work in the fields of education or healthcare in the state. We are at the intersection of several demographic trends that will significantly impact our ability to grow our workforce and our economy. Connecticut's population decline continued last year with a population growth at a quarter of the national average. The Connecticut Business and Industry Association has highlighted how our shrinking population hampers our ability to spur economic growth. Currently, there are over 100,000 open jobs in Connecticut that employers are struggling to fill. Being able to retain and attract residents to the state requires that we provide key quality of life services, education, and healthcare. Yet it is in these sectors that we are encountering a critical labor shortage. According to the Connecticut Center for Nursing Workforce, 50% of nurses in Connecticut are over the age of 50. This means that we can expect significant retirements in the next 15 years, just as we are facing the aging of 76 million baby boomers nationwide, many with multiple chronic diseases. A 2018 statewide nursing education report found that Connecticut nursing schools have limited seat capacity and can only accept 21% of qualified applicants. Of those graduating, only 25% stay in the field past the first year. It is critical that we seek ways to expand the number of seats available to students seeking nursing degrees and that we provide incentives for them to remain in the field. Similarly, according to a recent survey by the Connecticut Teachers Association, 74% of teachers are considering leaving the profession earlier than they had planned. In addition, there has been a sharp decline in the number of students enrolling in and graduating from teacher education programs. I urge the committee to explore ways that we can retain graduates in the fields of education and nursing. These might include loan forgiveness for students from nursing and teaching programs if they remain in the state for a minimum of 2 years and are working in their profession. Increasing the capacity of existing nursing and teaching education programs and expanding clinical and internship programs prior to and after graduation. Creating partnerships between state agencies, healthcare trade, and professional associations to develop a workforce strategic plan and supporting new employees through mentoring and induction programs. And finally, accepting out-of-state credentials and or easing certification or accreditation requirements where appropriate. I thank you for your attention to these important issues.
Representative, thank you for your testimony. I do not see any questions, so I'm sorry, my co-chair, Representative Haddad.
Yeah, Representative Khanna, I just wanted to thank you for your testimony. I appreciate the perspective that you bring to our committee, and I think that you put your finger on, the right, at least two of the serious shortages that we experience in fields in both education and in healthcare. Particularly in healthcare and with nurses, I wondered if you had, you mentioned expanding capacity of programs is important. And that's a goal I think that maybe this committee can and should consider. I've asked the University of Connecticut, and I think, plan on asking folks at the state university system as well, for ways that they can expand opportunities to train additional nurses. Additionally, as I understand it, one of the bottlenecks in the nursing pipeline is making sure that nurses can get the clinical hours that are required for them to become fully licensed. I guess I'm just wondering if those are the kinds of efforts that you're speaking of particularly. I had a bill a couple years ago that would have created a tax incentive for small businesses, practices really who employ RNs and other kinds of nurses to expand the number of preceptorships. That's the mentorship that's required for a nursing student to get their clinical hours as a way of expanding, easing this bottleneck and expanding the number of opportunities that folks might have. And so I didn't know if you had any additional specifics around tactics that we can employ, or if you think you could get behind some of the ones that I just mentioned.
Yes, I can. And to your point, as I mentioned earlier, there are about 13,000 applicants. Of those, 21% accepted into programs, and of those, only 25% stay in the field past the first year. So it's critical to offer more opportunities to enroll in, more seats, and also offer, the ability for nurses to have mentors who can shepherd them through the process past the first year, and to ensure that they stay in the field.